Hi, my name is Carmen. Welcome to my channel on rheumatoid arthritis. Today I'm going to talk about REMICADE, or also known as Infliximab. REMICADE is a biologic medication. It works on the TNF-alpha cytokine, which is similar to Humira and Enbrel. It is made by Janssen Pharmaceuticals. If you go to the Janssen website, I'll put a link, and at least right now in 2015, they are offering the drug for $5. If you have good commercial insurance in the U.S., like Primera or Aetna, then people who have that good insurance can qualify to get this $5 medication. And if you're on Medicare, which I am on, you are able to get this medication through your Part B plan. So it doesn't come on your Part D drug formulary, it's on your Part B, because you have to go into a specialty center to get the drug infused, intravenous infusion. It is not available sub-Q. You can't take it home. You can't get it at the pharmacy and take it. You have to go in and have a drip done, which for Medicare people is actually a really good thing, because then your Part B does come in and cover it. In my experience, getting it infused anywhere from depending on the dosage, can be from $14,000 to $25,000 each infusion date. And after all is said and done and Medicare marks it down and pays, the copay is about $700 for each infusion. You can, what I do is work with the hospital to get charity care on that $700, so then they reduce it way down, and then I owe like $70 every time I get an infusion. So I've been really lucky so far that the hospital I'm working with does have charity care. So you really get to think ahead about that. It's a live medication, so when you go in for your infusion, you get asked a lot of questions about your health, how you're feeling, do you have any scrapes or bruises, or do you have a cold or anything like that. And they ask you all these questions before they even mix the drug. The drug is freeze-dried, some kind of protein made with mouse molecules or something. And they mix it, and then you get it. I think it might be good for 24 hours after they mix it or something, but I prefer, with that kind of cost, I want to get it within 10 minutes after it's been mixed. So you go into the infusion center, it's very comfortable. The nurses are really incredibly nice at the infusion center I go to. They're very professional. They know everything. They can answer all your questions. You sit down and get your drip. It's, you're usually there about 3 hours by the time you go through the process of getting approved to get your infusion, and then they order it from the pharmacy, and you're there quite a while. Some of the side effects that can happen right during the infusion are headaches, nausea, kind of a hot flushing or burning sensation in the arm, things like that. Your blood pressure can really skyrocket. So they're monitoring you for all of those immediate side effects that might happen, and they will slow down the drip if that happens, to see if, that usually will get you through it. I have been on REMICADE for over a year, about a year. I get my infusion every 6 weeks, and the nice thing about REMICADE is they can push your infusion dates out up to 8 to 10 weeks, or they can even bring it down to 4 weeks. And they also can, your doctor can increase the dose or lower the dose. There's some flexibility in there. So it's not like either you can take it at this dose or you can't take it. There's a little more flexibility, which is nice. The nurses at the infusion center kind of explained to me that if your symptoms are coming back about 4 or 5 days, before your next infusion, then that's kind of the perfect timing. If you're having a lot of pain and symptoms for 3 weeks before your infusion, then you might want to ask your doctor, bring it from 10 down to 6. And anyways, so your doctor will follow you with that, but you gotta pay attention to what happens too, so you can report it and be active in requesting a different schedule and a higher dose if you need it. Some of the side effects that have happened with me that have increased over this year. When I first got it, the first day I was fine after the infusion, but the next day I just felt really tired for 2 days, like really tired. I was in bed, for 2 days. And I keep a little diary in my calendar, and I noticed that I would write tired, slept, and over the course of the year it got to be 3 days, 4 days where I was sleeping after the infusion. I also have begun to experience a lot of itching, internal, like everything itches from the inside out, my doctor is concerned about that, but not horribly concerned about it. I mean, I had some itching in my throat and in my ears, but it, so far hasn't escalated. So I'm now taking 40 milligrams of prednisone right before my infusion, and I'm also still taking the Benadryl, and then I continue to take the Benadryl every, 8 hours or however much it's allowed for like 3 days after my infusion. And that has really cut down on that itching, and the other symptoms I experience are chills and hot and cold flashes and just feeling like I have the flu. So that's unfortunate, but I've been on so many medications, I'm not going to switch off to something else unless I absolutely have to. To try to figure out the finances of a new drug is really hard. It seems, studies show that people get on biologics and they last maybe a year or two. You're lucky if you get on one and you stay on it for 5 to 7 years. That's, it's more like we're jumping around on these because either they don't work or we're experiencing side effects that are not tolerable. As I've had rheumatoid longer and longer, I can accept more side effects than I used to be able to. I used to freak out at small things. I can't take this anymore. And now that I'm getting limited on the choices that I have, I'm going to stay with this unless I, end up in the hospital or something. So there's also, of course, the other long-term side effects that are scary. And they're on the prescribing information sheet, which I will link to. I always read those sheets on any drug I'm on. You can always go to drugs.com and find that information sheet, or you can go straight to the manufacturer website by just typing in the name of your drug. That's usually the first thing that'll come up on Google is the website. So you can read really the nitty-gritty of side effects. For this particular drug, it's lymphomas is a big concern, but mostly for teenagers and early 20-year-olds seem to have that effect, side effect, which is a huge side effect. And then respiratory illness or bacteria or infection, which is also common with a lot of biologics seem to have that same issue with the respiratory problems. So you just watch for that, and talk to your doctor. My doctor monitors me very close. I have I have blood tests taken every time I go to get my infusion, and they go to the doctor. If there's any concern, she calls me, which there never is a concern, but usually I'm the one that makes the appointment to go in. If I am starting to feel strange on any of my medications, I'll go in and talk about it. Anyway, you can find all the info you need on drugs.com on these medications. It's the lymphomas, the respiratory illness, anyone with any kind of heart condition, heart disease, they don't want to give these drugs because they find that it escalates the heart disease quite a bit. And other than that, it's, the nausea and headaches and things like that are workable. You can work with those. The efficacy on REMICADE is pretty good. As far as biologics go, I think Enbrel really has the #1 spot on this, but not for everybody. Some people can't take Enbrel or it doesn't help them, but it has the highest efficacy and the lowest side effect profile of all these biologics. But we can try them all and see what works for us. And it is, REMICADE is used for rheumatoid, but it's also used for Crohn's, ulcerative colitis, juvenile rheumatoid, psoriatic arthritis, ankylosing spondylitis. So it's been around a long time. I think it was one of the first ones out in 99, or maybe even earlier than that, so 15 years. It originally came out for fistulizing Crohn's disease. That's what it first came out for. And so it's been around a long time. They know the safety profile, they know what to look for, so you can feel pretty safe taking it. Well, we just got to go for it, you know. It's about quality of life, I think. And so, yeah, that's my experience with REMICADE. I hope it will continue for me for a while. Yeah, if you have any questions just about the procedure and stuff, I'll be happy to answer. This is my first video, so I'm sure I've left things out, but that's my experience with REMICADE. And if you're if your doctor's considering giving you that, I say give it a try. I think it's safe. They monitor you closely, and it's been around a long time, and it might work for you. You know, it's worth a try if you can find the money to cover it. So thanks for checking out my channel. Please stay tuned and take care until I see you again. Bye.